Hello, this is Jerry. Today, let's talk about the consequences of AI in labor market. Compared with September, there were around 150,000 job cuts in America last month, the highest number over the past 20 years, triggered by AI adoption and cost cutting. This surge, a 183% increase from September, and 175% increase compared to the October 2024, gave markets many concerns. Big companies like Amazon, UPS, Intel, IBM, Microsoft, and many other tech companies announced significant layoffs recently. So, are you worried about your job now? Honestly, this is a big shock for me because I think AI is still on the very early stage, and layoffs because of AI is coming far beyond my expectation. Based on the data from outplacement firm Challenger, Gray & Christmas, these layoff cuts bring totally 1 million job losses from this January to this October, 65% increase from same period of 2024, and also highest level since 2020. Just looking at these staggering numbers made me feel anxious, and maybe I will also be dismissed by my company in the near future. If we cannot change how AI will impact our lives, so the best strategy for individuals should be to adapt ourselves to dance with AI rather than ignore it. Because AI is still in the very, very early stages, do not be manipulated by the media, saying AI is invincible. That's not sure. Once we rationally rather than emotionally analyze the value of AI for certain industries with systematic framework, you will become less anxious about your job. Currently, AI is pretty powerful only on certain industries, especially requiring repetitive moves, not on most industries. Today I want to share one industry which many people bluffed will be replaced by AI, and the reality is that AI is still one marginal tool for that industry, its healthcare industry. Let's use IBM failure to demonstrate why AI is not invincible but fragile. In 2007, IBM chief researcher David Ferrucci led a team to develop its secret weapon, Watson AI, and after defeating human in one program, Watson entered into public vision in 2011. In 2011, IBM announced that Watson would become an AI doctor. In the same year, WellPoint, a US healthcare service provider, partnered with IBM. Watson assisted nurses in handling complex cases and reviewing medical requests. In 2014, MD Anderson Cancer Center at the University of Texas collaborated with IBM on the Moonshot Project to develop the Oncology Expert Advisor software to assist in formulating cancer treatment plans. In addition, the Mayo Clinic, Bumrungrad International Hospital in Thailand, Memorial Sloan, Kettering Cancer Center in New York, etc., also launched collaborations with Watson. In April 2015, IBM established the Watson Health Division. Subsequently, it invested approximately $4 billion in acquisitions such as acquiring medical data, companies Phytel and Exploris, medical imaging company Merge Healthcare, and Truven Health Analytics, to improve the data foundation and ecosystem. In April 2019, IBM announced the halt of the development and sales of Watson's AI drug, R&D tools, due to poor sales. After that, the business focus shifted to clinical development, but the market response remained poor and sales continued to decline. In July 2018, it was reported that Watson had prescribed drugs prone to causing bleeding to cancer patients with bleeding symptoms, raising questions about its reliability. In the same year, the medical department carried out significant layoffs and key management personnel left. In 2021, the Wall Street Journal reported that Watson Health's annual revenue was only $1 billion, and it was not profitable. IBM initiated the selling process. In early 2022, foreign media reported that IBM intended to sell the business for $1 billion, and the transaction was later completed. In summary, IBM's AI story did not prove that it is reliable and professional enough to help doctors to treat patients in the real world. Even in 2025, After Watson's failure, there is still no mature AI applied in the core parts of healthcare industry. And even in China, many AI companies focused on healthcare are struggling to gain their trust from both patients and doctors. So, the slogan, "Doctors will be replaced by AI," is just an arrogant joke. We use IBM case is not to belittle this great company, but to show us the reality behind AI. The key factors to decide whether AI will take your job in your industry include following elements. Firstly, what key pain points from your industry can be addressed better by AI? This is the key. If not, AI is useless. For example, my friend invested one AI company which used robots to make dishes. The novel idea brings some appeal at the beginning, but was abandoned by customers very soon. Why you need AI robots to make dishes far less delicious than a big human chief? Secondly, what's the market size for this industry, and whether users are willing to pay for AI service? If the market size is too small, the AI is not commercially viable and will not take your jobs away. Even for the ChatGPT, you will see this giant need billions of US dollars to support its operation. Whether ChatGPT can exist for a long time is a big question. Thirdly, what's the attitude from legal perspective and the government side? As we know, due to data process and data protection, different countries have distinctive laws and tight regulations for data flow. So for some industries, AI cannot overcome these barriers, let alone taking jobs from humans. So after these sharing, we would know that AI will change some industries, but is far less to bring fundamental changes for many industries. No need to worry too much about this.